Hi, my name is Mike Hayton. I'm an orthopaedic hand and wrist surgeon, and I'd like to talk to you about ganglions. Well, ganglions are the commonest lump that we find around the hand and wrist, and most commonly they occur on the back of the wrist. And here's a clinical photograph of a classic ganglion. Other common places are on the front of the wrist and also around the base of the fingers. Well, let's just concentrate on the commonest, on the back of the wrist. Patients present with a lump which is often quite tender and is made worse with the wrist being cocked back, and that's simply because the lump becomes squeezed between the bones. We really don't know why they occur, but we think it's some kind of an outpouching of fluid from the joint which contains a jelly-like structure. Historically, we were told to hit them over the back of the wrist with a Bible, and certainly that is still a technique used by some patients. Often we advise patients that these will resolve spontaneously, but occasionally patients want to speed up this natural process, and in this particular case we'll often offer them aspiration. And an aspiration is where local anaesthetic is applied over the top of the ganglion and perhaps even into the ganglion, and then with a wider bore needle the ganglion is aspirated and the jelly-like substance is drawn out of the ganglion. We often like to puncture the wall of the ganglion a few times to try and cause some irritation so that the lining of the ganglion, the lining of the walls, will stick together. Unfortunately, aspiration isn't always successful, and this may need repeating a number of times. Ultimately, the patients may wish to have surgery, and in fact some patients wish to go straight for surgery. Surgery is either performed under general or local anaesthetic. Usually it's a day case procedure. An incision is made over the ganglion. The overlying structures, including blood vessels, nerves and tendons, are retracted out of the way, and the ganglion is dissected down to its stalk from the capsule and is removed. Having removed this, dissolvable stitches are often inserted under the skin and butterfly stitches over the top. A bulky dressing is applied, which is kept on for the first 2 days. After this time, the dressing is removed and the steri-strips and the butterfly stitches are kept in place, and the wound is kept clean and dry for 10 days. But we often encourage patients to move the wrist early to prevent stiffness. Ganglion surgery is relatively risk-free, but we do quote a 1 in 10 chance the ganglion can come back. Other risks are associated with damaging blood vessels and nerves and tendons, but really these should be at an absolute minimum, probably occurring less than 1%. The real risk is that the ganglion can recur. If it does recur, we can perform secondary surgery, again with a 10% recurrence risk.